This PowerPoint contained few common questions and answer that is frequently asked in NCLEX board exam. And it gives some tips on how to answer the question and are likely to be accessed in NCLEX board. Let me go one by one. First question about the diabetes mellitus. A client with diabetes mellitus is admitted with hypoglycemia. Which information should the nurse include in her client teaching? Select all that apply. Number one, hypoglycemia can result from excessive alcohol consumption. Two, the skipping meal can cause hypoglycemia. 3. Symptoms of hypoglycemia include thirsty and excessive urinary output. Number 4. Vigorous activities may result in hypoglycemia. Number 5. Symptoms of hypoglycemia include the shakiness, confusions, headache. And number 6, hypoglycemia is a relatively harmless situation. The correct answer is number 1, 2, 4, and 5. Number 1 says hypoglycemia can result from excessive alcohol consumption. 2, if you do not eat lunch or dinner, or if skip the lunch or dinner, can cause hypoglycemia if you have diabetes, and also if you take the insulin. Number 4, vigorous activities may result in hypoglycemia. Number 5, symptoms of hypoglycemia include the shakiness, confusion, and headache. Rational said alcohol consumption, missed meal, or vigorous activities may lead to hypoglycemia. Symptoms of hypoglycemia include the shakiness, confusion, headache, sweating, and tingling sensation around the mouth. Thirsty and excessive urination are the symptoms of hyperglycemia. Hypoglycemia can become a life-threatening disorder involving seizure or death to the brain cell. The client should not be told that the condition is relatively harmless. Here we can compare and contrast the signs symptoms of hypoglycemia and hyperglycemia. So when my patient have hyperglycemia, we will give them insulin, right? So when patient have hypoglycemia, we give them carbohydrate or IV dextrose or glucagon. So hypoglycemic patient have sleepiness, sweating, pallor, lack of coordination, irritabilities, and feeling hunger. In case of hyperglycemia, we can see dry mouth, increased thirsty, frequent urination, means polyuria, polyphagia, and polydipsia. Blur of vision or difficulty of vision, headache, and weakness. In this table, we can see the algorithm for the treatment of hypoglycemia in adult with diabetes. If my patient has a mild hypoglycemia, how I understand my patient is a mild? Definitely blood sugar level. But patient should conscious, oriented, and able to swallow. If your patient have it, then give them 10 to 20 milligram of quick acting carbohydrate, right? Also test the blood sugar level after 10 to 15 minutes. If still less than 4 millimole per liter, we could repeat up to 3 times. If this has been repeated 3 times, consider IV 10% glucose 150 to 200 ml over 15 minutes or 1 gram glucagon intramuscular. If my patient has a moderate hypoglycemia and patient conscious but confused, disoriented, or aggressive and able to swallow. So if capable and cooperative, treat as for mild hypoglycemia. If not capable and cooperative, but can swallow, give either 1.5 to 2 tubes of glucogel or dextrosel. Also, we could check the blood sugar after 10 to 15 minutes. If still less than 4 millimole per liter, repeat above up to 3 times, or if ineffective, use 1 milligram glucagon intramuscular. If still hypoglycemic or deterioration at any stage, call the doctor and consider IV glucose. So in case of mild and moderate, blood glucose level should now be above 4 millimole per liter and give 20 grams of long-acting carbohydrate. That is 2 biscuit or 2 slices of bread or next meal if due. If intramuscular glucagon has been used, given 40 grams of long-acting carbohydrate in order to replace the glucagon store. In case of severe, means patient unconscious, having a fit or very aggressive or nil by mouth, always check the EBG, arterial blood, right, concentration. Blood gas analysis is also important. Also, we will check air flow, we will check the breathing and circulation. Also stop the IV infusion, first brief of, also notify to the doctors. If the patient is suitable for intramuscular glucagon, right, give 1 milligram glucagon intramuscular. If not, give the IV glucose and repeat up to 3 times. What next? Question: a client present to the physician office with gray brown with epidermal curved ridge and follicular papules of the skin. The physician diagnosed the patient have a cavities. So which teaching point should the nurse review with the clients? Select all that apply. Number 1, disease is actively contagious only when the lesions are present, open. Scabies is transmitted by close person-to-person contact or contact with infected linen and cloth. Number 3, the most commonly infected area are hands, feet, and neck. Number 4, severe itching of affected areas, especially at night, is a common finding. 5, only the infected individual needs to use prescribed medication. Number 6, all the client's linen and clothes should immediately be washed in hot water. So select all that apply. The correct answer said 2, 4, and 6. To say scabies is transmitted by close person-to-person contact and contact with infected linens and clothing. Number 4, severe itching of the affected area, especially at the night, is a common findings. Number 6, all of the client linens and clothes should immediately be washed in a hot water. Rational said, the nurse should inform the client that scabies is a contagious disorder caused by a tiny mite that is under the skin, and it is transmitted by close person-to-person contact or contact with infected person's cloth. The causes severe itching, especially at the night. In addition to the familiar papular rash, all of the client linens and clothing should be washed promptly to reduce the risks of reinfestations. Scabies is transmissible from time of infections to the time of boros and papules appear, which may occur several weeks afterward. It remains transmissible until it's eradicated by a prescription cream or an oral medications. The scabies is most commonly seen in finger webs, flexor surface of the wrist, and also antecubital fossas. If a family member is diagnosed with scabies, all family members must be treated with medications, and their cloth and linen must be washed to prevent transmission and reinfestation. In this picture, we can see is the scabies skin rash. So, what is scabies? Scabies is a skin condition characterized by intense itching caused by burrowing mite on the skin. Most common symptom, intensely itching rash that is worse at night. Sore on the skin from itching, also tiny blister formation that look like the papules or pumpkins. Also the tiny discolor of the affected area. In some people, the thick cast formation on the skin. So what are the treatment? Product called scabicide. So the medication that is kill or eradicate the organism. Antibiotics may be necessary for any infected skin sore. Also, no over-the-counter product are appropriate for a scabies treatment. Itching may continue for several weeks after the treatment, right? What are the duration? A scabies infection will usually last until is treated thoroughly even after the treatment. Next, here little bit more about the scabies. As you know, the scabies is a skin disease caused by the small insect that cannot be seen with the naked eye. The most of the common symptoms itchy the skin rash frequently located on the finger, wrist, inguinal area, or armpit. How we can get scabies? Close or intimate contact with the infected persons. Also, sharing the clothing, towel, even bedding. So, how can be treated? We can use the cream, or when you use the cream, take a shower, apply the cream from neck to down. Also, leave the cream on for 8 to 14 hours and take a shower. Also, some medication, oral treatment with pill called ivermectin can use. Next question. A client arrives at emergency department with deep partial thickness and full thickness burn over 15% of the body. After admission, his vital sign, blood pressure 100 over 50 millimeter of mercury, heart rate 130 beats per minute, and respiratory rate 26 beats per minute. Which nursing intervention are appropriate for this client? Select all that apply. Cleaning the burns with hydrogen peroxide. Number 2, cover the burn with saline. Also, number 3, starting IV infusion of lactate ranger solution. Number 4, placing ice directly on the burn area. Number 5, administer 6 milligram of morphine IV. And last one, administer tetanus prophylaxis is ordered. So select all that apply. So more than one answer is here. So correct answer here, number 3, 5, and 6. So first of all, starting the IV infusion of lactate ranger solution, right? It's correct. 5 said mean 6 milligram of morphine intravenous, and number 6, administer tetanus prophylaxis is ordered. So the goal of the immediate intravenous for this client should be to stop the burning and relieve the pain. To prevent hypovolemic shock and maintain the cardiac output, the nurse should begin intravenous therapy with a crystalloid solution such as lactate ranger solution. Our patient came emergency department because of full thickness burn. So patient lost the body fluid. When body fluid loss, blood pressure go down, hypovolemia develop, hypotension develop. It leads to the shock, and it is called hypovolemic shock. And shock lead to the death. So we need to give them replacement of fluid. So IV infusion. What kind of solution we use? We use the lactate ranger solution. Frequently asking question in NCLEX board. Also, to treat the pain, she should admit 2 to 25 milligram of morphine or 5 to 15 milligram of meperidine. Other name of meperidine is called Demerol. We give them IV in a small, right? Small increments. The nurse should also administer tetanus prophylaxis as ordered. So tetanus prophylaxis can prevent any kind of wound infections. Hydrogen peroxide and providing iodine solution should cause the further damage to the tissue, right? So it is good to avoid. Towel, soaked towel, saline soaked towel could lead to the hypothermia. So it is good to avoid too. So next question. A nurse is preparing a distance teaching plan for a client with atopic dermatitis. Which instructions should the nurse include in her teaching plan? So, number one, wear only synthetic fabrics. Now use a topical skin moisture daily. Number three, but only the 3 times per week. Number four, keep the thermostat above 75 degrees Fahrenheit. So what is correct answer? So the correct answer is use a topical skin moisture daily. So in this picture, we can see the atopic dermatitis. Atopic dermatitis, also known as eczema, right? Basically, eczema or atopic dermatitis, a group of skin condition characterized by redness. You see the red and itchy rash. So, the restaurant said the nurse should instruct the client to use the topical skin moisture to keep the skin hydrated. Likewise, the client should be encouraged to bath, bath daily. Also minimize the irritations. The client should wear only cotton fabrics. The client should maintain a room temperature between 68 degrees Fahrenheit to 72 degrees Fahrenheit. So the most common symptoms: dry, scaly skin, redness, itching, and also painful lesion, right? Fluid fill, blister develop. So how we diagnose? Diagnosis involves physical examination and test to rule out other conditions. Let me recap the treatment. So the treatment helps to reduce the redness and itching of the skin with medication and application of creams. And this cream is moisture daily and keep the skin hydrated. Next, which discipline should be consulted when caring for a client with a stage 3 heel ulcer? Number one, nutrition support and orthotics, physical therapy and respiratory therapy. Number three, occupational therapy and infectious disease. Number four, plastic surgery and cardiology. So question said, which discipline should consultate with when caring the client with stage 3 heel ulcer? So in this picture, we can see the ulcer in the heel. So in the patient who have it, it is good to check the nutritional support and Orthotics. Rational said the nutritional support should be consulted, evaluate the client caloric needs for wound healing. So a good nutrition helps to healing the wound. Orthotics should also be consulted for specialized footwear and designed to keep the pressure of the client heal. Physical therapy is necessary to keep the client achieved the highest level of functioning. However, the respiratory consultant is not necessary unless the client has a coexisting respiratory problem. Occupational therapy may be helpful to assist with activity of daily living, but an infectious disease consult is not necessary unless the client has a coexisting infection. A plastic surgery consultant may be necessary if debridement or grafting is likely, but nothing indicates it is a that patient need to go for cardiologist. In this picture, we can see the 4 stages of ulcer. Stage 1, it is showing non-blanching eruption and skin is intact. Stage 2, partial thickness of the skin and ulcer involve epidermis and dermis. So the most two outer layer of the skin we called epidermis and dermis. Stage 2, these 2 layers get involved. Stage 3, the full thickness skin loss and subcutaneous damage. Ulcer extend down to fascia. Pressure as shallow cracks occur. You see the subcutaneous tissue and fascia look like. Stage 4, the full thickness skin loss with extensive destruction, tissue necrosis, damage to the muscle, bones, and tendon. Bones get involved in stage 4. Next question. A client with deep partial thickness and full thickness burn on the arm and receive autograft. 2 days later, the nurse finds the client doing the arm exercise. The nurse provides additional client teaching because this exercise may, number 1, dislodge the autograft. Number 2, increase the edema in the arms. Number 3, increase amount of scarring. And number 4, decrease the circulation to the finger. So correct answer said number 1, dislodge the autograft. So rational said because exercising the autograft site may dislodge the grafted tissue. The nurse should advise the client to keep the grafted extremity in a neutral positions. Exercise does not cause increased edema, increased scarring, and decreased circulation. So, question A, nurse is planning the care for the client with a pressure ulcer. Which statement should the nurse include the client nursing care plan? Select all that apply. Number 1, use pressure reduction device. Number 2, increase the carbohydrate in the diet. Number 3, Reposition every 1 or 2 hours. Number 4, teach the family how to care of the wound. Number 5, clean the area around the ulcer with mild soap. Number 6, advise the use of support surface therapy. The correct answer said number 1, 3, 4, and 5. Pressure ulcer, also known as pressure, bed sore or decubitus ulcer. So, pressure ulcer, which occur on the skin surface due to the prolonged pressure. Example, a patient lie down for a long time. So lying down in bed without movement, sitting on a wheelchair, or a cast use for prolonged period may cause the bed sore or pressure ulcer. So particularly patients who develop the pressure ulcer, they have some common sign and symptom, and we need to know how to help them. Like redness of the skin, dark scar, chronic wound or swelling, tender skin, right? Common symptom. Anyway, the correct answer, use the pressure reduce device. 3, reposition every 1 to 2 hours important. Teach the family how to care of the wound. And 5, clean the area around the ulcer with a mild soap. Restaurant said, using a pressure reducing device, repositioning every 2 hours, and cleaning the area around the wound with a mild soap will aid in healing or will prevent further skin breakdown. Teaching the family how to care for the wound will assist with discharge planning. Protein, not carbohydrate. Intake should be increased to promote wound healing. Supportive surface therapy is a measured therapeutic method for managing the pressure, friction, and also shear the tissues. Here we can see the different stage or grade of the ulcer, different pressure ulcer. Grade 1, you see the picture, progression of a pressure ulcer. This is the layers of the skin: epidermis, dermis, hypodermis, and bones. So in this picture, you can see the skin lesion, impaired, broken the outer 2 layers of the skin. Here we can see the damage is eroded to the hypodermis and finally get involved tendon and bones. So in case of grade 1, this is grade 1, the skin damaged but intact. So no blanchable erythema, redness, and intact skin. Discoloration of the skin, edema developed in duration of or hardness may also be used as an indication, particularly on individuals with darkened skin. Grade 2, we say partial thickness skin loss involve epidermis, dermis, or both. The ulcer is superficial and present clinically as a abrasion or blister formation. This is the blister. Grade 3 or stage 3, full thickness skin loss involving damage or necrosis subcutaneous tissue that may extend down to but not through underlying fascia. Grade 4C, extensive destruction, tissue necrosis, or damage the muscle, bones, and supporting structure with or without full thickness skin loss occur. So, question here: when planning care for a client with burns on a upper torso, which nursing diagnosis should take the highest priorities? Number one, ineffective airway clearance related to edema of the respiratory passages. Number two, impaired physical mobility related to the disease process. Number three, disturbed sleep pattern related to the facility environment. And number four, risks for infection related to the breaks to the skin. So out of four, definitely number three is not an answer. So number 2 and 3 risks the infection. It is important to prevent infection, but respiratory passage or continue the airway or breathing is most priorities. So the correct answer said number one, ineffective airway clearance related to edema of the respiratory spaces. Restaurant said when caring for a client with upper torso burn, means upper part of the body, throat, chest, nose, the nurse's primary goal is to maintain respiratory integrity. Therefore, ineffective airway clearance related to the edema of the respiratory passages should take the highest priorities. Impaired physical mobilities related to the disease process is not appropriate because burns are not a disease. Disturbed sleep patterns related to the facility environment and risks for infection related to the breaks in the skin may be appropriate, but they do not command a higher priority than ineffective airway clearance because they do not reflect immediately life-threatening problems. Risks of infection, sleep disturbance, it is not life-threatening, but airway clearance is a life-threatening because they can cause the stoppage the respiration. So this is few question and answer. It can help pass the NCLEX licensing exam.